HealthTech listeners, this is the podcast where we tackle some of the trending topics, ideas and best practice across health and social care.
We don't want to be like some of the other systems. We want to drive impact, we want to drive change.
We knew from talking to our partners that there's so much positivity across health and social care, but it never really gets shared. There's people that work in the industry that do amazing things every single day, that if we could share that a little bit or find a way to do it, that they may be able to kind of inspire other people in the industry as well to do similar things.
You don't get feedback from everyone, then you don't really have feedback. We're only going to speak to maybe 10 or 12 of the 80 employees that we have. You instantly would have a problem with the validity of that information.
What is appreciative inquiry? That provides a perfect segue into that. That's what it is. It's a heart set and it's a mindset and it's a way of looking at the world through a generative kind of set of eyes rather than a kind of negative, deficit-based focus.
I remember actually going there and seeing the nurses and, touching my sister when she was in the incubator and then just touching it, and the nurses were just talking to me and I felt, they're advocating for patient safety in a way to ensure that my sister comes home.
Yeah.
In that respect, and that was nice. But at the time I was young, I didn't know. But on reflection, I can look back and think, wow, that was so impactful. And I always remember that throughout my nursing career.
Probably vulnerability and not coping isn't a weakness or a failure. And I think just from my own experience and talking to other people who have been through that, it's one of the reasons you don't speak out, because you feel like a failure and you feel like you're not being strong, when actually being vulnerable and being open and talking about it means that you're a lot stronger for doing that than not. It's flipping it round, that actually you are a stronger person for saying you're not okay. That would probably be my biggest takeaway.
We had 20 complaints about clinical care, but actually we had 50 compliments as well. Yeah. And I think it changes the narrative then. And I think that then helps our staff and empowers them to say, it's not all about all the bad stuff. It's also about, the good stuff that happens more often than not as well.
Many years ago, when I owned a care home in West Yorkshire, we took our residents to see the Blackpool illuminations, and there was around 10 or 11 of residents and quite a number of members of staff that came along to this trip. One or two of these residents had not been to Blackpool for many, many years, and to see their faces and the enjoyment that they had by going on this trip, going to a place that they had long forgotten, was really, really special. And we ended up having fish and chips at Harry Ramsden's, and it brought us all closer together somehow. It was a real special trip. Really, I'll never forget it. It was absolutely amazing.
It's really varied, isn't it? No day's the same, no trust is the same, no area of healthcare is the same, and everyone is there because they care.